Good morning to all of you, to Gisela, to all those who ensure that this broadcast goes out on different media outlets, including the radio, to our sign language interpreter, and most importantly, to everyone tuning in to our briefing each morning. Today, 1,377 people are hospitalized in Cuba. 49 are under observation. There are 746 suspected cases and 582 confirmed active cases. A high number, given the amount of confirmed cases we have seen over the last 15 days. Yesterday, over 4,000 samples were processed. 4,350 were processed in our various molecular biology laboratories. 1,667 were processed at the Pedro Curi Tropical Medicine Institute, 806 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 697 in Havana's, 656 in the Genetic Engineering and Biotechnology Center Lab, 283 in Santiago de Cuba's Hygiene, Epidemiology and Microbiology Center, 24 in the Molecular Engineering Center, and 217 in the Civil Defense Laboratories. Of the 4,350 samples processed, 48 tested positive for SARS-CoV-2 and COVID-19. These 48 cases bring the total number of samples processed in the entire country since the pandemic began to 332,039, of which 3,364, or 1.01%, have tested positive for the virus. Samples from all of the country's provinces were studied, more from some than others, according to the COVID-19 situation in each territory. 117 was studied from Pinar del Rio, 126 from Artemisa, the highest number, 2,885 from Havana, 122 from Matanzas, 137 from Cienfuegos, 354 from Villa Clara, 130 from Camagüey, 102 from Holguín, and 180 from Santiago, and so on and so forth from all of the country's provinces. Of the 48 positive cases diagnosed yesterday, all are Cubans. Of these, 39 are confirmed case contacts. This means that confirmed case contacts account for 83.9% of all diagnosed cases since the start of the pandemic, representing the highest risk group. Of the 48 cases diagnosed yesterday, the source of infection linked to 9 is yet to be determined. Like I always mention, work continues to locate the source of infection in all such cases, given how important it is to controlling the spread of the virus. This brings the total number of cases where it has not been possible to determine the source of infection in Cuba to 213. Meanwhile, none of the people who tested positive for the virus yesterday contracted it abroad, meaning that imported cases remain at 318. An equal number of women and men tested positive for the virus yesterday, 24 men and 24 women, each representing 50% of all confirmed cases in the country. This is a unique trend in Cuba, as men dominate the statistics at a global level. Of course, when we look at fatalities and critical cases by sex, we see that, again, men dominate both here in Cuba and worldwide. 17 people, or 35.4% of the 48 diagnosed cases yesterday, were asymptomatic at the time of testing. These cases therefore account for 57.4% of all positive cases on the island. When we look at this figure over the last 15 days, it stands at 59.4%. By age group, 8 positive cases yesterday are under the age of 20, for a total of 371 cases in this age group. 310, or 83.5% of which, have been discharged from hospital. Meanwhile, 20 cases yesterday are between 21 and 40 years of age, 15 are between 41 and 60, and 5 are over the age of 60. Of the 48 positive cases yesterday, 43 belong to Havana. There are 2 cases from Artemisa and Pinar del Rio respectively, and 1 case from Villa Clara. From Artemisa, one of the cases belongs to the municipality of Mariel, and the other to Bahia Honda, both of which are linked to the outbreak in Mariel. The 2 cases from Pinar del Rio belong to the municipality of La Palma. The case from Villa Clara is from the municipality of Camajuaní, again linked to an outbreak in that municipality. The 43 cases from Havana belong to the municipalities of 10 de Octubre with 9, Boyeros with 7, Centro Habana with 5, Arroyo Naranjo with 4, San Miguel, Plaza and Habana del Este with 3 each, Playa, La Lisa and Habana Vieja with 1 case each, and 1 case reported in Cerro, Marianao and Guanabacoa. As we can see, cases are spread throughout Havana, increasing the risk of infection for those in the city. Yesterday's results mean that Artemisa continues to be the province with the highest confirmed case per 100,000 inhabitants rate over the last 15 days, registering 22.33. Havana follows with a rate of 21.31 per 100,000 inhabitants, higher than yesterday's. Villa Clara's rate also increases to 3.47, as does Pinar del Rio's with a rate of 1.03. Las Tunas has a rate of 0.37, Matanzas with 0.28, and Mayabeque with a rate of 0.26, are all similar to yesterday's figures. This means that Cuba has a rate of 5.44 confirmed cases per 100,000 inhabitants over the last 15 days. To summarize, of the 3,364 people who have been diagnosed with the virus thus far in Cuba, 582, or 17.3%, are active hospitalized cases, a high number as you can see. 575, or 98.5%, are clinically stable. No COVID-19 related deaths have been reported in Cuba in the last 13 days, meaning that the country continues to have registered 88 fatalities since the start of the pandemic. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 72 people were discharged from hospital, a positive result achieved through the hard work of our healthcare professionals and individualized treatment plans. 50 of the recovered patients are from Havana, 1 is from Pinar del Rio, 12 are from Artemisa, 1 is from Mayabeque, 2 are from Matanzas, 4 are from Villa Clara, and 2 are from Santiago de Cuba. As I always mention, 2 patients were previously evacuated at the start of the pandemic. This means that to date, 2,692 people, or 80% of all confirmed cases in Cuba, have recovered from the virus. 5 people were reported as critical yesterday, while 2 are reported as serious. Meanwhile, the 88 fatalities registered in Cuba mean that the country has a mortality rate of 2.61%. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 258,921 people were diagnosed with the virus, for a total of 21,472,570 since the start of the pandemic, practically 22 million people. 5,659 people died of the virus yesterday, for a total of 766,080 COVID-19 fatalities and a mortality rate of 3.56%. The region of the Americas reported 136,981 new cases of COVID-19 yesterday, for a total of 11,589,851 confirmed cases. Yesterday, 3,417 people died of the virus in the region, bringing the COVID-19 death toll in the Americas to 418,547 and a mortality rate of 3.61%. These figures show that the region accounts for almost 54% of all COVID-19 cases worldwide. Regarding worst affected countries, Lillian, do we have the graph? There it is. As you can see, the United States continues to top the list with 5,361,165 cases and 169,481 COVID-19 fatalities. More than 1,000 people died of the virus in the US yesterday, 1,035 to be exact. Next comes Brazil, as you can see, with almost 4 million confirmed cases. Then India, with over 2,589,000 cases. Russia follows, then South Africa, and from our region, Peru, Mexico, Colombia, and Chile. This is the information that we have on the behavior of the pandemic in Cuba and the world.